love this, my favorite book. And he says, if it's meaningful, I do it. If it's not meaningful, I don't do it. That'll change your whole life too.
Welcome to the Hopeaholics. Recover out loud, baby.
The scariest thing to go into, say, a doctor, a therapist, a psychiatrist, you name it, is feeling some sort of doom. But that was the exact opposite, because you leave feeling like I want people to leave when they listen to our podcast. You leave with hope because there's a solution. And that solution is healthy supplements that you can take for your brain.
That's what I love. Well, welcome to the Hopeaholics podcast.
Thank you.
And I will say today we have Dr. Amen in the house. Very excited to have you here.
Thank you so much.
You're a big deal, Doc. You're a big deal.
Not when I go home. So true. My children still roll their eyes. Someone will recognize me when I'm out, and they're like, "Oh, this again."
That's hilarious. Keeps you humble.
How do you feel about that when somebody recognizes you out in public?
Well, almost all the time, people are grateful for the work I do, so I feel good about it.
Mm-hmm.
Nice.
It gets irritating sometimes.
Yeah.
But no, I love it.
Nice. Yeah, I get a little bit excited every time. And sometimes overly excited because I'm new to people recognizing me, and I get a little like excited. I'm like, oh wow, they watched my podcast.
Yeah, it's good. That means that people are actually paying attention and finding whatever it is that you're putting out there. Obviously, you're on a different level because it's your brain. You're also a different level because you're helping people see that there is a solution in their addiction. It's huge. It's changing people's lives.
So, how did you get started? And how did you figure out to do the brain scans? Where did that all come about?
So when I was 18, Vietnam was still going on, and I became an infantry medic, and that's where my love of medicine was born. But about a year into it, I realized I didn't like being shot at. It was not for me. Some people like it. It is no. So I got myself retrained as an X-ray technician. That's very important for my story. And I came to learn, our professors used to say, how do you know unless you look? And in 1979, I'm a second-year medical student, and someone I love tries to kill herself. And I take her to see a wonderful psychiatrist, and I came to realize if he helps her, it doesn't just help her, that ultimately it'll help me as someone who loved her. It'll help her children and her grandchildren as they would be shaped by someone who is happier and more stable. When I went to medical school, it wasn't to be a psychiatrist. But I just fell in love with psychiatry because I realized it could change generations of people. But I fell in love with the only medical specialty that never looks at the organ it treats. And my dad, growing up, had two favorite words. And the first one was bullshit. Heard it all the time. Bullshit. And the second one was no. Right? No matter what question you asked him, the answer was no. And so as I progressed in my career, I'm like, bullshit. We should not be the only medical professionals who never look at the organ they treat. No, this is wrong. And I was the chief psychiatrist at Fort Irwin, which is in the middle of the Mojave Desert. I spent 2 years, 40 miles north of Barstow. And I started looking at the brain, first with a study called quantitative EEG, and then later after I started our first clinic in Northern California with a study called SPECT, brain SPECT imaging. It's a nuclear medicine study that looks at blood flow and activity. It looks at how your brain works. 1991 upends everything I do. Most psychiatric illnesses are not mental illnesses, they're brain health illnesses. Get your brain healthy and your mind will follow. And that just changed everything. It's not you have these symptoms, take these drugs, see me in a month. I came to realize that's really a stupid way to practice. It's like, no, what are you eating? Are you exercising? How are you sleeping? What nutritional supplements are you taking? The brain is an organ, just like your heart is an organ. It's public knowledge. I've been Justin Bieber's doctor, and in his documentary Seasons, he tells the story about coming into my office, and he goes, I think I got what you're trying to tell me. My brain is an organ like my heart is an organ. If you tell me I have heart problems, I'll do everything you said. And then as he falls in love with his brain, he gets better. And that's where it starts. And I was not taught that.
Yeah.
My psychiatry training, there was actually very little about brain health. But when your brain works right, you work right. And when it doesn't, you don't. And so for the addiction community, why aren't we scanning everybody's brain who's out of control? Right? First of the 12 steps is you have to admit your life is out of control. I actually think that's step 2. We can talk. I rewrote the 12 steps based on neuroscience. But if your life is out of control, why isn't anybody looking at the organ of control, which is your brain?
I mean, I think that's the thing that hooked me, and seeing obviously your show, your podcast, your content, especially out now, is why is it just this one little phrase? Why is it that the psychiatry, that one doctor, why aren't we looking underneath the hood? Why aren't we looking at that organ that they are treating? But you would naturally assume that I did. I thought, in a sense, that's what it was always. You're always looking at it, but not really. You're just getting prescribed medication for something.
Based on symptom clusters.
Yeah.
Yes.
Which is how Abraham Lincoln was diagnosed with depression in 1840. So that's 184 years ago. Lincoln had severe bouts of depression. He was suicidal twice in his life. And in the winter of 1840, went to his doctor, Anson Henry, in Springfield, Illinois. And how did Dr. Henry diagnose him? He talked to him. He looked at him. He looked for symptom clusters, depressed, can't think, negative thoughts, suicidal ideas. He goes, oh, you're depressed, and prescribed treatment for him, which was god-awful then. Think of it, though. I think of addiction or depression like chest pain. Nobody gets a diagnosis of chest pain. Why? Because it doesn't tell you what's causing it. There's 100 different causes of chest pain, right? From a heart attack to a heart arrhythmia to a heart infection to gas to grief to anxiety. So there's 100 causes of chest pain.
Yeah.
It doesn't tell you what's causing it. It doesn't tell you what to do for it. Depression is the same way. It's not telling you anything about what's causing it. There was a big national story out a couple of years ago. It's not serotonin. Now, sometimes it is serotonin, but the big headline was low serotonin is not the cause of depression. And it's like, well, then what are we doing with all the SSRIs that knock off your libido and decrease motivation and often decrease attention span? What are we doing giving them wholesale? And 85% of psychiatric drugs are prescribed by non-psychiatric physicians.
How much?
85%. In 10-minute office visits.
Yeah.
And they're being prescribed by your nurse practitioner, by the PA, by the internist, by your gynecologist. And no one's thinking. They'll tell you what it is, but they won't tell you why it is. And if you don't know why, you're not going to be very effective. And in large-scale studies, SSRIs were no better than placebo. Now, I know for the right person, they can work really well.
Sure.
So don't stop your medicine without talking to somebody smart. But don't just buy
Totally.
you're depressed. Find out why.
And not only that, but wouldn't you want to take, if you have to take a medication, wouldn't you want to find and take the best one for that specific reason and why you're taking it, as opposed to taking something where I've had multiple friends end up getting diagnosed and then prescribed SSRIs, and it's doesn't work for them. Then they have to either increase a dose or go to something else, or have negative side effects where it's like whether it's gaining weight or they become extremely depressed, and has the counter effect that they originally thought that was going to help them go on this medication in the first place. And then to go off of the SSRI is another thing.
It's a nightmare,
a nightmare.
for a lot
Nightmare.
of people. Funny story, maybe not so funny, but when I met my wife, I really liked her, still do. And 3 weeks later, I'm like, you haven't seen the clinic. You should come to the clinic. And I scanned her, right? Because I'm not falling in love with anybody
Sure.
until I see their brain.
Yeah. That's hilarious.
It's not happening. And when she was in her 20s, she had thyroid cancer and then got really depressed. When you steal someone's thyroid, right, at the time, they killed her thyroid gland.
Sure.
And she got really depressed, and the doctor put her on Prozac. And she goes, I don't like how I feel. So he increased the dose. And she came back and she said, I'm not me. I'm making bad decisions. And she actually ended up in Costa Rica on a dare, doing things that were not consistent with her own values. And
Wow.
it would, and I told her when I said Prozac's the wrong drug for you, because Prozac SSRIs increase serotonin. Serotonin is an inhibitory neurotransmitter. It calms things down in the brain. Well, her frontal lobes were already sleepy, so she had ADD. She didn't know it, but when we scanned her, she had ADD, and it made her more ADD with less anxiety. So more impulsive, but didn't care. She was more impulsive. So you can see the wrong medicine can completely disrupt your life. And nobody's looking. So if I make you worse, right, I make you more impulsive. Now all of a sudden I'll go, oh, well, she has a personality disorder. And now all of a sudden someone will get the diagnosis of borderline personality disorder, narcissistic or whatever, caused by the doctor, by flying blind and changing your brain in not a good way.
I mean, that's horrific.
So I do have a question, because brain health is a big thing. Can you define brain health in your terms?
Well, your brain, the physical functioning of the 3 pounds of fat between your ears, the brain's 60% fat, is involved in everything you do, how you think, how you feel, how you act, how you get along with other people. It's the organ of intelligence, character, and every decision you make. And when it works right, you work right, and when it doesn't, you don't. I've tried to simplify this over the years. I mean, we can go really deep if you like, but basically brain health is 3 things. Brain envy. You got to care about it. Nobody cares about their brain. Why? You can't see it, right? Since we scanned you, you care a whole bunch more about your brain. I often say Freud was wrong. Penis envy is not the cause of anybody's problem, right? I've not seen it once, 40 years being a psychiatrist. It's brain envy. Got to love and care for your brain. And that's what the imaging did for me. When I scanned myself in 1991, it was not great. And I was a bit horrified. My 60-year-old mother had a better looking brain than I did. And so I wanted her brain envy, got to care about it. Avoid things that hurt it. Know the list. And quite frankly, most second graders will get a 90% on the list. If you show them good for the brain, bad for the brain. I went into my daughter's second grade class and I wrote 20 things on the board. I'm like, separate these for me. Good for the brain, bad for the brain. They got 19 out of 20
Wow.
right? They put like football and hitting soccer balls with your head and alcohol, nicotine, marijuana. They put them all in the bad category. The only thing they put in the good category that belonged in the bad category was orange juice. It's too much sugar.
Really?
Whenever you unwrap fruit juice from its fiber source, it turns toxic in your body. So eat the orange, kill the juice.
Oh my gosh, like that is a huge one. I'm sending Emily, make a mark of this because I'm sending it to my dad. So my dad's health is not the best, but for whatever reason, I have no idea. I asked my mom the other day too. I'm like, what is his deal? Because every morning, no matter what, he has basically like, like a shot, essentially, not literally in a shot glass, but the amount, the equivalent of orange juice. And I'm like, why? And he's
It's a habit.
Yeah, I have no idea. But why haven't his doctors told him, hey, Barry, this is probably a very bad idea considering he has colon cancer. He has he started dialysis a couple months ago, so he's going in dialysis 3 times a week. Diabetic, those types of things where I'm pretty sure he's seen the nutritionist like a million times. So why haven't they rolled out orange juice for him?
Well, because a lot of people think it's a health food.
I mean, clearly he does because I've asked him.
But diabetes is a disaster for brain function. Mm-hmm. And if you have it in your family, you always want to be on a diabetes prevention program, right? So I have this mnemonic we could talk about called Bright Minds. You want to keep your brain healthy or rescue it, you have to prevent or treat the 11 major risk factors that steal your mind. And the G in Bright Minds is genetics. Mm-hmm. But I don't think we think about it correctly. It's like, oh, I have obesity in my family. That's why I'm overweight. It's like, no, you have the vulnerability. Sure. It's your behavior that caused you to be overweight. If you have diabetes in your family, so I have obesity and heart disease in my family, but I don't have either. Why? Every day I'm on an obesity, heart disease prevention program. And if you have diabetes, every day you should be on a diabetes prevention program.
I've pretty much been on a diabetes prevention program since I was like 25 because my dad's diabetic and I didn't ever want to be diabetic.
Never want to be diabetic. And if you are, you have to be so serious about it because you start losing limbs with diabetes. But diabetes, as blood sugar levels go up, blood vessels become brittle and they start to break, which means sores don't heal. Mm-hmm. And your brain can start to deteriorate because if you go, what's the one thing I should do besides love your brain? It's love your blood vessels, right? Blood flow is so important to every organ, especially your brain, which is only 2% of your body's weight, but uses 20% of the blood flow in your body. So we talked about brain envy, got to care about it. Mm-hmm. Avoid things that hurt. Know the list. Some of them are controversial, not to me, of course. Dry January. Awesome. Avoid things that hurt it and then do things that help it. Like be passionate about something. New learning is absolutely essential. I know, I'm like I'm the happiest whenever I'm engaged in learning something new. It has a physical effect on your brain. And simple supplements, multiple vitamin, fish oil, extra vitamin D for most people. Saffron is one of my favorite supplements.
Have you, but there are vitamins, multivitamins and stuff that they sell that have toxins in them.
There are.
Yeah.
Yeah. Like
and those
they'll have folic acid.
Yeah, folic acid.
Folate.
Yeah.
So cyanocobalamine for B12. I'm like, why are you eating cyanide?
Yes, the cyanide.
Right. So you have to be thoughtful and educated. But, we live in a society of deficiencies, vitamin D deficiencies, magnesium deficiencies. Choline is the biggest deficiency.
And these are all things that are for brain health, not just body health. This is full body and brain health.
Right. Well, your brain is part of your body. I mean, one of the big ahas I got, when I decided to be a psychiatrist, like, I don't need to know about these other specialties. It was stupid on my part, because if your kidneys aren't right, your brain's not right.
Yeah.
If your liver's not right, your brain's not right. If your heart's not right, your brain's not right. One odd statistic. I turned 70 this year.
Oh, wow.
And 70% of 70-year-olds have erectile dysfunction. I'm like, no, that's not okay with me. 40% of 40-year-olds have erectile dysfunction. But you know what that means? It means you have vascular problems. It means 40% of 40-year-olds have brain problems. 70% of 70-year-olds have cognitive problems. They have brain problems. I'm not okay with that, which is why I exercise, which is why I eat right, which is why I'm not overweight, which is why I don't, use nicotine and marijuana, because they all decrease blood flow.
And can we talk about
Wow.
food, because that's been a big thing on social media lately, because a guy named Gary Brecka has helped Dana White from the UFC change his health, right? And a lot of the stuff that's coming out is the stuff that you're talking about, the folic acid, the different vitamins, but they also talk about GMO foods. Can we talk about food and what your thoughts are
we
on
should talk
food?
about food in treatment centers. I think, like, my mom was just in the hospital, and I watched what they fed her, and I'm like, you're trying to get her to come back. And I'm like, why in hospitals and treatment centers do we feed people like crap? And it's insanity. When you're trying to help people be well, you're not giving them the nutrition to allow them to be well. And you think of senior centers, where people with dementia are allowed to choose what they want to eat. And so they're going with bread, pasta, potatoes, rice, fruit juice, sugar, which is accelerating their demise. Now, some people would say, why are you so serious about this? It's because brain health is serious. This is serious. Every day you're making your brain better, or you're making your brain worse by what you're doing. So if you think of what's an ideal brain healthy diet, colorful fruits and vegetables, healthy protein, and healthy fat. There's a study from the Mayo Clinic where they looked at people who had primarily a fat-based diet. So think salmon, healthy oils, nuts and seeds, avocados, 42% less risk of getting Alzheimer's disease. And then they compared it to the standard American diet, the simple carbohydrate-based diet, bread, pasta, potatoes, rice, fruit juice, sugar, 400% increased risk of getting Alzheimer's disease. It's the food.
Yeah.
Food is so important. And you can't supplement your way out of a bad diet.
Right.
You can't supplement your way out of drinking too much. You want a healthy brain. And it all comes down to this. I've thought about it more and more the last couple of years. Have either of you ever been in like a bad relationship?
Yeah.
Me too. I was married to somebody for 20 years that
wow.
I didn't like, and she didn't like me. And
Way to stick it out.
Oh my, I know.
yeah, I used to think
Wow.
being persistent was a good trait of mine, until I realized stalkers are persistent.
Yes, they are.
Oh,
Very
my
persistent.
goodness.
So I know what it's like to be in a bad relationship. And I know what it's like to be in a good relationship. I'm not going to be in a bad relationship with food or with things I drink. I'm only going to love food that loves me back.
Yeah.
I'm only going to love things I drink that love me back. You're in a relationship, and the most important primary relationship is with you, right? It's with yourself.
Yeah.
And Lincoln, I made a video with this today. Lincoln said, discipline is making that decision between what you want now and what you want most. And what I want most is energy and clarity and memory and creativity and passion and purpose. That's what I want most. So when I think of the fries, because I can like fries, it's like they don't love me back. So I need to break up with the fries.
Do you ever have fries?
No.
No?
Well, it's actually interesting that you say that, because so we were kind of, because we're definitely always talking about food and our supplements and health, because I truly believe health is wealth, because if you don't have your health, then you have nothing. And so when it comes to certain things like fries or say cookies or something that sometimes I really do enjoy, what I have noticed a very big difference is, for instance, my husband is a really good cook and he likes to bake, but if he bakes, say, some cookies for myself, it's these 5 ingredients that we know exactly what is in them, as opposed to the, say, a gluten-free cookie that I buy at Trader Joe's, which has a ton of other types of cottonseed oil or other oils that you
Tapioca starch.
something.
Yeah.
Exactly. Where I significantly notice the difference if I say have one of these from Trader Joe's that's supposedly like, whatever, the gluten-free, so-called healthy, as opposed to these 5 healthy ingredients. The difference it has on my own body is
Right.
insane.
And you can, I love things that love me back. So I have sparkling water with, I have a Chick-fil-A ice machine at home. It's actually not Chick-fil-A, it's something else. But that
Yep,
soft,
the bomb.
the soft, crunchy
We have
ice.
one of those.
I love
We have
Yeah.
one of those here in
So
the kitchen.
Yeah.
sparkling water,
Amazing.
cool ice.
Yeah.
There's a company, I have no relationship with them, called Sweet Leaf. They make 11 different flavors of stevia. And I like the chocolate stevia. Love the chocolate stevia. And it's like, it's dessert for me. Or I get frozen blueberries from Costco, of all places.
Yep.
Organic. They need to be organic. And it's like candy. So we're all creatures of habit, right? And bad habits take exactly the same amount of energy as good habits. And so you just have to find 20 foods you love that love you back.
Bless
Excuse
you.
me. Sorry. I tried.
Have you ever done that on the
I don't think so. I think it was my first one.
Okay.
Yeah.
Well, thank you.
Yeah. I agree with that. I feel like, and I always, anytime that I try to like navigate away from those, say, 20 foods that I know that I absolutely love and love me back, I'm upset with myself, because I genuinely feel it from not only like my like physical self, but my mind.
See, that means the 4-year-old in you is not in charge. See, when people don't get well, it's because the 4-year-old in them is in charge. I want what I want when I want it, right? I had this one person I was working with for a long time, loved him. We're not making progress. And ultimately his child, unconscious child, got out and said, I want what I want.
And I want it now.
And I'm like, you're being a bad parent to yourself, right? Because good parents are firm.
Yes.
No. And they're kind. It's like, we could do it. You're gonna like this later. It's like, we can do this, and I think that's like the one thing that prevents people from getting well. It's giving in to the inner child that's still out of control.
It reminds me of, do you guys remember Willy Wonka and the girl that I want it now, Daddy, and eats the grape, and then what happens?
I don't remember.
You don't?
No. Huh?
Yeah, exactly. The blueberry. And then she literally eats it and then basically winds up, gets fat and blows up, and then she pops, right?
Because of a blueberry?
Yeah, because she wasn't supposed to eat it.
Oh.
Willy Wonka said no. And because they're in the, chocolate factory, and she's like, no. And then she's a little brat and said, like you're saying, your inner 4-year-old child is speaking out at you. And she's like, but I wanted to know, Tati. And then eats it, and then look what happened. He
And
died.
it's not a matter of should. I don't want people to hear this, although people often tell me I'm the voice in their head,
Sure.
helping them do the right
because
thing.
people need to learn how to grow up, and if you want to get well, then you got to do the hard shit. And sometimes that's difficult to hear and listen to. And it's like shoulda, coulda, woulda. No, you need to do this. You need to be disciplined. We are in 2024. This is a new year. And if you want to be a new year, new me, little meme, then buckle up.
So let's soften that just a little bit to I have my patients replace should. I should do this. I must do this. I have to do this. I ought to do this with I want to do this, or it fits my goals.
Or I get
to do this, or I get to do this. But it's away from the negative motivation to the positive motivation, because going back to what do I really want? I want to be in the same size jeans I was when I was in high school. I like that. And yes, it's totally vain, but it's a symbol of I'm in control of my body rather than my child is in control of my mind.
Or how about I want to wake up feeling good. I want to wake up not feeling depressed or have anxiety or feel crippled. It's like, yeah, well, you need to do some stuff that you don't want to do.
When for sure. And you know, and the other part about it though is when you're eating high quality food, you aren't as hungry.
Yes.
You feel nourished. When you know, you take out the crap that America puts in the food. You take out the crap, and I still get to eat amazing things, amazing foods that I cook. And usually they're single ingredient foods, and it's all organic. And I'm never as hungry. I'm not as hungry as I was prior to doing this. I mean, me personally, I've been on this real. I've always ate healthy, so I thought, until I realized I was still eating a lot of processed foods, and I was eating a lot of non-organic foods. And then I started having like some health problems, such as high blood pressure, and I was damned if I was going to be put on a high blood pressure medicine. That wasn't happening. And then what happened? I had. I was having some gut issues. I completely changed my diet after watching a Gary Brecka video that she sent me, that her husband sent her. Long story short, I changed my diet to these single ingredient, all organic, high quality foods. The doctor said, I need you to come off the proton pump inhibitors because you might have some infection thing, H. pylori. And you need to be off those for 2 weeks. So I was like, all right, I don't know how I'm going to do this, but I've got my diet on point. I came off the proton pump inhibitors, and my GERD has been gone ever since.
Wow.
Gone.
So acid blockers, it's sort of not rational when you think of you need acid to digest your food properly. And now once you go on them, people just don't stop. And, we could talk about gut health. It's so important to brain health. There's a direct correlation between your gut and your brain. And so many people are walking around with leaky gut, unhealthy microbiomes, the bugs in your gut. And I remember I told my daughter about the bugs in her gut when she was 8, and she's like, ew. I'm like, no, you need to think of them as your pets. And you have to take care of them, and they'll take care of you back, or your defense force. And I love how all of it works together, even to the point where if you have past trauma, it changes your microbiome to make you more anxious the rest of your life. So if you have childhood trauma, my wife, when I met her, she writes about a lot of this in her book, The Relentless Courage of a Scared Child. You've heard of the ACE questionnaire, right? Adverse childhood experiences, 0 to 10. 0 is none. I'm a 1. She's an 8. So she grew up with a lot of trauma. Her uncle was murdered in a drug deal gone wrong when she was 4. She still remembers her mother and grandmother screaming, falling to the floor.
Wow.
And then about when she's 4.5, she starts going to the hospital because she has this chronic GI problem. And she's got an upper and lower GIs. And, you know, as we're getting to know each other, I'm thinking, it could have anything to do with the murder.
Yeah.
No. And I'm
Yeah.
like, maybe.
How did she clear that up?
Well, my first gift to her, it was 10 sessions of EMDR. And EMDR is a specific psychological treatment for trauma.
Okay.
And she went for 2 years. Dramatically
wow.
changed her life. Like her gut is fine now.
Wow.
And we like hardly ever fight, where my first marriage, I always thought of it as Friday night at the fights.
Sure.
It was awful.
Yeah.
And it's like we just don't fight, in large part because she's managed her trauma and I've dealt with my own. And I'm a huge fan of 4 big circles. If you think of your clients, your patients, yourself, it's like, what's the biology? And so that's the brain and the body. What's the psychology, which is how you think, and past traumas and developmental issues, also successes. What's the social circle? Who are you connected with? I mean, it's coming out of a second tiny habit that'll make a huge positive difference. In the psychological circle, is it true? Right? Whatever I think, give your mind a name. Like I named my mind after my pet raccoon when I was 16. Because your mind often is unbridled.
For sure.
And you need to discipline your mind.
The
And so when you get a thought, just ask yourself whether or not it's true. Don't accept it just because your brain created it. And in the social circle, notice what you like about other people way more than what you don't like about other people.
Oh, wow.
My God, that'll change your whole world because you'll learn something called personal power. You're either reinforcing negative stuff in other people or you're reinforcing positive stuff. I go get my wife to yell at me in 10 seconds. Why, the tone of voice, the attitude, being condescending, whatever. I know how to do that. But I could also make her smile and give me a kiss in about 10 seconds, just by noticing what I like about her, which is so many things.
For sure.
And then the spiritual circle is, does this matter? Does it have meaning in my life? I don't know if you've read Viktor Frankl's book, Man's Search for Meaning, but I love this, my favorite book. And he says, if it's meaningful, I do it. If it's not meaningful, I don't do it. That'll change your whole life too.
I like that.
Yeah.
Makes sense to me. And I mean, I can do the same thing if I really want my husband to not to be happy. I can definitely bring that up. No problem. But if I want to, make him happy as a clam and all as well, I can do that as well.
And it doesn't mean you roll over, right? I have a mnemonic for relationships I like called relating. It's be responsible for it. Like I'm 100% responsible for people go, I'm 50% responsible. It's like, you want to be 100% responsible for yourself in this relationship. Know the goal, kind, caring, loving, supportive, passionate relationship. Know the goal. Does my behavior fit?
Totally.
and then empathy, listening, which we've lost, assertiveness. We teach each other how to treat us by what we tolerate. But you can say something, like, if we're at a party and my wife said something I didn't like, I'll tell her I didn't like it, but I'll do it in a loving way.
So you need to be able to tell your partner something like that. So that way it doesn't just blow over their head or something,
Right, because she has the same goal. And hopefully, people who are listening, you have the same goal with your partner.
Of course.
Right? And mine's just so simple: kind, caring, loving, supportive, passionate relationship. Always want that. Don't always feel like that.
Yeah.
I get these rude thoughts that just show up. But if you can protect the front part of your brain that's involved in forethought, judgment, impulse control, and you don't say everything you think. Some of my ADD patients, they wear that like a badge. I say everything I think.
Yeah, well, you're a shithead then.
That's
Read my thoughts, man. It's like, that is not okay. I've killed
right.
that.
Most people would be
Yes.
like that.
Yeah.
Yes.
Right? Is, unbridled, violent,
100%.
sexual.
Exactly.
All of it.
All of it.
All of it.
All of it.
Right?
All
And
of
that's
that.
normal.
Yeah.
Just don't say it.
Totally. Everything
Right?
is all
and,
good.
and it's not the thoughts you have that make you suffer.
Right.
It's the thoughts you attach to
Yeah.
that make you suffer. I get these thoughts like, don't believe that, and don't say it, and don't do it.
Yeah. Yeah.
I don't feel like, I know Shane's not here and we probably shouldn't talk about him, but we all know Shane.
Yeah, what's up, Shane?
Yeah. We need to check his frontal lobe.
He doesn't have. I don't. Shane, for
We
sure.
need to get him down for the brain scan and
So, just so on the record for everybody, so that they can watch my brain scan on Dr. Amon's podcast as well, because I think that it's very exciting. But my frontal lobe, because I was diagnosed with ADHD and ADD like when I was a kid.
Yeah.
Like out the womb. And it's clearly prevalent in my brain scan, because like my blood flow to my frontal lobe is quite low, right?
Right.
Look at me.
That's why
Look
you
at
and
me,
Shane
because
get
I'm
along so well.
genuinely loving. Huh?
so that's why you and Shane get along so well.
How dare you? So how dare you? But I was basically going to say, from one that knows that her frontal lobe is quite low, but I do have impulse control these days, and I pay attention because I'm cognizant of that in me. My fellow partner Shane has
Definitely.
probably zero blood to his frontal lobe.
And but knowing that,
Yeah.
at least for me, it gives me empathy.
Sure.
Right? When I working
Completely.
optimally, it's
Well, it goes hand in hand. So that's why health is wealth, and health meaning on
Just like what
all
you said.
elements, right? So your brain to my physical body to my spiritual well-being. And they all have to be in full, like everything has to be going like a well-run engine. So that means like obviously my sobriety hits kind of, the spiritual and the daily discipline, but mind, body, soul is on one. So it's like your supplements, your working out, and what you're eating. So it's like if you're not feeling well, I know a lot of people that are depressed, including myself, was like struggled with depression for quite some time, but the chemicals that I was putting inside my body, I mean,
We're making
I would
you
be
depressed.
depressed as well. Like it makes sense if you put two and two together. It's like, yeah, no wonder you're depressed. So just doing Exactly. Look at diet. Look at your, like, all of the things that you do have direct control over. You have direct control over, like I tell my parents, all I want you to do is walk for 30 minutes a day. That's it. I don't want you to think anything more than that because they're older. And so you have direct control over what you do to your body, meaning like your movement, right? And what you're putting inside of it. So your nutrition alone. So if you're eating McDonald's and Taco Bell and processed foods all day, every day, and having 40 ounces of Mountain Dew, you're not going to be doing good. And you're not only is your insulin and your sugar spikes all over the place, that directly affects your mood. So you're depressed, or all of a sudden you have these like weird outbursts of like, whether it's crying or all over the place, but it's because your insulin is like this, like a ping pong all over the map. And so that directly affects so many other
You're not
things.
getting the right nutrition to the
Well,
brain.
and if you think of performance, because I
Oh
know
my
a
God,
lot
that
of
too.
athletes will do carb loading.
Oh, yeah.
And I worry, if they're a sprinter, that might work really well. But if they're going to play a basketball game that goes over 2 hours,
Or a football game.
they may have a good first half and a terrible
Completely.
second half. I got into a national fight with
Really?
Lamar Odom, who used to play forward for the Lakers.
Yeah.
It came out during the NBA championship with the Boston Celtics that he was eating about $80 worth of candy.
He was on our podcast.
He was, and I'm like, because
Wait,
I was a
candy?
season ticket holder to the Lakers, and Lamar was a space cadet.
Yeah.
Like Kobe'd throw him the ball and he wasn't even looking.
Yeah.
I'm like, come on, get rid of the kid. Or frosted flakes or Pop-Tarts
Pop-Tarts
or
and all
donuts or pastries. They give kids and what happens? Blood sugar goes up, and then about 45 minutes later it goes down and their brain is in mud. And we're like, here's this teacher, she's not all that awesome, you're bored to
Yeah.
tears, focus. And it doesn't happen.
Yeah, you
And it's like, oh, you have ADD. And so I know there are a lot of kids that have ADD, including some I love in my family. And the medicine helps them so
Sure.
much. But let's not increase the risk of
I agree.
ADD. Let's always be decreasing it.
So, well, I know we're really getting close to being out of time, but I wanted to ask one last question.
Oh, yeah, we are. You're actually right on that.
So we've talked about everything. We've talked about what we put in our bodies. What about what we put in our body, in our brain through our ears?
Well, you become what you listen to. You become what you read. You become what goes in. And there's so much negativity now. People who just start the day with the news are 27% less happy in the afternoon.
That's so
So I have an app I like called the Good News Network, and I like always sending stuff to Natalie or people I love. And you have to be really mindful about what goes in your head, but also in the heads of your children.
Yeah.
For sure.
I feel like, it's one of those things, and I don't know if it's gotten like overridden because we do live in, there's pros and cons to social media, right? It's a amazing tool. However, I feel like a lot of like obviously negativity has gotten like exacerbated on it as well. But when it really comes down to the basic fundamentals of your health, it's really quite simple. But we like to overcomplicate it, and I think it's because people want, or at least I know in my case, you want a quick fix. You want to take a pill, or you want to have this and all of a sudden feel better, or lose those 10 pounds, or all of a sudden your brain function is firing on all cylinders, when it's so much more than that, in the sense of what it comes down to is your diet, organic, healthy foods, exercise, drinking a good amount of water, staying away from the sodas, staying away from processed foods, and taking the correct amount of supplementation for your specific body. That's it. But we want to...
Well, and loving yourself and getting away, just like you said, from now versus now and later. You want to do things that help you feel good now. And when people get on our Brain Healthy program, they feel better quickly. But they also feel better a year from now or 2 years from now or 10 years from now. Develop the habits you can keep for the rest of your life. If you're just doing it to get into the dress for the wedding, but you're going to keep your same habits, well, you're always going to do it. And the more you yo-yo, the harder it's going to be over time. One thing before I go that I just dearly love, which is, I talked about these daily habits, good for my brain or bad for it. I start every day with today is going to be a great day. Being with you today was on my list. I'm like, today's going to be a great day. Before I go to bed at night, I go, what went well today? I do it every night. And
what you're talking about, because we have the 12 steps, and basically it lays it out like that, where our 10th step is kind of like an inventory. So it's like doing those little things, and then we start our mornings, with God in a prayer. It's doing little things and making those habits where you're not jumping straight into the news or something like that, where you're altering your I guess head capacity into something negative, where you're basically creating those habits daily so that you're staying on that trajectory of, I would say, a happiness. People are searching for happiness, it seems like, a lot more these days. And having some type of habit or plan, I feel like, is the way to go. And from what you're saying now, I'm interested in seeing your, what did you say, neurological rewritten 12 steps?
yes, in my book, Your Brain is Always Listening, I talk about, I was thinking...
I have that one.
I was thinking, 12 steps haven't been rewritten in
Yeah,
85 years. And
Especially
they're not terribly effective when you look at the effectiveness research. It's about 10% of people stick with it.
Because they're lazy.
No, it's because there's no neuroscience in it. And addiction's hard. I mean, let's just be honest.
Sure,
Addiction
it
is hard. But we could benefit from the neuroscience. And so, for example, I think step 1 in the 12 steps should be step 2. Step 1 is, what do you want? You got to tell your brain, what do you want? Relationships, work, money, physical, emotional, spiritual help. What do you want? That's step 1 for me. Know what you want. Then step 2 is easy, because you'll know, is your behavior screwing up what you want? Your life is out of control. Step 3 is get your brain healthy, right? You cannot keep poisoning it. I have a poster that hangs in about 100,000 schools around the world called Which Brain Do You Want? Healthy scans surrounded by drug-affected scans. People can see it. It's on Instagram.
Yeah.
Which brain do you want? And if you're rational, you want the healthy brain. And right away you see drugs and alcohol damage the brain. So that's got to be front and center in my mind in any drug treatment program. Love your brain. You are ruining it. Step 4 is what kind of brain type do you have? I wrote a book with David Smith, who founded the Haight-Ashbury Free Clinic, called Unchain Your Brain, Breaking the Addictions That Steal Your Life. And we talked about there's 6 different kinds of addicts. Stop giving everybody the same plan. They're impulsive addicts, so that's our ADD group. They're compulsive addicts, that's our OCD group. There's impulsive compulsive addicts. Those are the children and grandchildren of alcoholics. They're their own special group, and I studied them extensively. There's the sad group. They're medicated in underlying depression. There's an anxious group, and there's ed trauma group. So know your type so you can target the plan to their brain, not a cluster of symptoms. And it goes on and on. But
I know I have that book, so I'm going to dive into it, because even just off of the 6, I'm like, well, technically I'm kind of 3. I'm impulsive. I'm also a grandchild of my grandfather died of cirrhosis of the liver, and I'm also the number 6 with the head trauma. So,
and a lot of people have multiple
I'm the
types.
full-blown addict. But it's true. I like that, though, because I feel like for people that are suffering with like depression and things of that sort, if you put both those up, you can have a happier, healthier life. I think. Like in the sense of the stepwise, you know?
Yeah.
I like that.
Well, Dr. Amen, thank you so much for coming on our podcast. This was really informative, and
because I said it before we started like recording, and it's not necessarily a disclaimer, right? It's just basically stating the obvious. I got my scan, I would say Nat, like 4 weeks ago. And I have been on Dr. Amen's protocol, and which is basically just supplementation, just the what we were talking about, supplements. And I, so far, because I know you need to give it, some time, and it's only been 4 weeks, so that's not very much, but I feel a big difference.
amazing.
I know. That's why I was excited to have him on today, because I was really scared. I'm not going to lie. When I left the office, like, damn, he's going to come on the podcast, and I hope this shit works because I can't lie. So
now we can say shit works.
Yeah.
Shit
and
works.
I'm excited. And I'm like, obviously the protocol is continuous. So like, I'm going to do everything that is required, because why I care. Like you said, number one, what sticks out to me is you have to care about your brain. You have to care about your body. I really do genuinely, now that I've seen my brain scan, care about my brain. So now I want to give my brain the best chance it has with the supplementation, with me doing like hyperbaric chamber treatments and things of that nature. That is basically kind of along the regimen, because I have the brain envy, because I know what my brain can look like from seeing the scans. And that's the whole point.
If you do the supplements in the hyperbaric chamber, we'll scan you again.
Exactly. And then it can get, and that's what's exciting, is where it's not just like, oh, here you go, you're stuck with this. It's like, no, this is what you're working with right now. This is what you can do. And I'm all about results. So this is what it can get to.
And I'll notice the difference over here on the podcast.
Well, Emily's already noticed the difference big time. So for me, that's huge.
Again, I paid her to see that.
But Dr. Amen, thank you so much. Thank you for scanning my brain. Thank you for coming in today. Nat, we love you. Thanks for bringing this all together, because actually without Nat, we all wouldn't have actually met.
Yep.
And happy birthday, Nat. Filming on
yeah.
Happy
Nat's
birthday.
Natalie's birthday today.
That's right. So
Capricorn.
I know you, all my favorite people, Chad, you, Jonathan, my husband, Capricorns.
Yep.
Big deal. Yeah, exactly.
All right. Picture time.
Awesome.
Let's go.